Good afternoon, everyone. My name is Natalie Slaughter, and I'm the Director for Health Integration at the Association of State and Territorial Health Officials, also known as ASTHO. I would like to welcome you to today's webinar on engaging patients and providers with telehealth. ASTHO is committed to supporting state and territorial health officials and their leadership teams within the transforming health system. ASTHO, with support from the CDC, is providing this webinar to facilitate sharing of best practices and lessons learned related to engaging patients and providers with telehealth. This webinar is scheduled for an hour and we'll have time set aside for discussion with participants and to answer your questions. Now, in an effort to reduce background noise, we ask that you mute your individual phone or handset during the presentations and when you are not speaking. Also, please do not place this call on hold. If you have a question during the call, you are welcome to post it to the chat box on your screen at any time. These questions will be answered during the Q&A portion at the end of today's presentation. We will also open the phone lines during the Q&A session for you to ask additional questions. At the conclusion of the call, you will be directed to an evaluation survey, and we ask that you please take a few moments to complete the survey, as we would appreciate any feedback you have to help inform future ASTHO work. Please note that slides and the recording from today's webinar will be sent to all registered participants in the next few days. Now, I would like to introduce today's speaker. Mei Hua Kwong joined CCHP, which is the Center for Connected Health Policy, in March 2010. Where she works on public policy issues as they impact telehealth on the state and federal level. She is also the project director for the National Telehealth Policy Resource Center. For CCHP, Ms. Kwong manages projects, provides policy technical assistance to state and federal lawmakers, industry members, providers, consumers, and others. She oversees the CCHP policy staff and works closely with its partners and consultants. She has authored several articles published in peer-reviewed journals and has presented at national conferences. Prior to joining CCHP, Ms. Kwong was a public policy analyst for Children's Home Society of California, working on child care and early education issues on the state and federal levels. She also worked extensively with the Child Development Policy Institute, a statewide public policy organization, and was recognized in 2004 by them for her work in the early care and education field. She was also at the National Association of Real Estate Investment Trusts in Washington, D.C., working on federal tax issues, and administers the association's Political Action Committee. Ms. Kwong holds a BA in International Affairs from George Washington University and a Juris Doctorate from George Washington University Law School. I will now turn it over to Ms. Kwong.
Thank you. Excuse me. Thank you, Natalie. And I will apologize right now if I suddenly start coughing. I have a bit of a cold here. But thank you to ASTHO for asking me to do this particular webinar today on provider and patient engagement in telehealth. I actually think this is a bit of an overlooked area when you talk about telehealth. So much of telehealth, especially in the policy world, has been focused in on like reimbursement, the laws and regulations, and they haven't really focused in on, how do you get providers and patients interested in telehealth to begin with? So just a few things. As Natalie mentioned, I did graduate from law school, so as a lawyer, I always have to put disclaimers. So any information I give today should just be considered information. It's not legal advice. CCHP always recommends that if you're interested in getting a legal opinion, to please seek out counsel for that. And also, if I happen to mention a company or a product or show a picture or something like that, please know that CCHP has no financial arrangement or interest, and neither do I personally, with any of those companies. CCHP is completely grant funded in what we do. We do occasionally have some sort of contract work on very discrete projects, but we take no money from vendors or equipment manufacturers. Just a little bit of background on CCHP. We actually started off as an organization focused on California telehealth policy. In 2012, we got the federal grant from HRSA to be the National Telehealth Policy Resource Center. So we have kind of a dual focus. So our California funder is still funding us. So we have a California-specific focus, but we also have a national focus with our federal grant. And what we do here is really looking to advance state and national telehealth policies that promote better systems of care, improve outcomes, and provide greater health equity of access to quality, affordable care and services, especially for people in underserved and rural areas. I mentioned we're one of the telehealth resource centers. We're the National Telehealth Policy Resource Center. There's actually 13 other resource centers located throughout the country. 12 are regional resource centers who have various states that they service. They are kind of like your first line of people that you contact. They help folks with who are interested in starting a telehealth program or have like specific questions in their area, or maybe they're looking to like do something with an existing telehealth program. There's also another national center. They are focused on technology. So if you have like questions on like a piece of equipment or software, they're a great resource to tap. They're located in Alaska. So we all work collaboratively together. So we try to be, the 14 of us, try to be kind of like your one-stop shop for all your telehealth needs. We don't sell you anything. Most of our services is provided for free because we have the federal grants to do this. But there's only a limited amount of that federal grant. So we provide a lot of resources and tools and information and technical assistance for free. But if it goes a little bit too in-depth, we might have to like talk about setting up a contract. And that's actually something that our federal funders have suggested that we do. But for the most part, most of what we do is like free of charge, and we try to help folks as much as we can, especially if they are serving underserved populations or located in rural areas. One thing that we do underneath our federal grant is we track all the telehealth policy laws and regulations for all 50 states and the District of Columbia. And we also track federal legislation as well. And we put all that information on our website. That's a snapshot of our website there. So you can go to that, click on a state, and they'll bring up all of the information. And we try to keep it regularly updated. We do 2 major updates every year, which is what makes this resource kind of unique from everybody else, because we do update it that frequently. Sometimes somebody might put out a report, but they may not like do a follow-up to that for like another couple of years. It is very labor intensive, so that's understandable why others may not be able to do that regular update, but we definitely do. That information is up to date up to March of 2017 of this year. The pending legislation gets updated a little bit more frequently just because we are tracking that. So that is located underneath each state as well. But we're here to talk about patient and provider engagement. Most of you are probably aware there's been a lot of legislation over the last couple of years, especially on the state level, regarding telehealth policy. Private payer laws where you would have health insurers pay for telehealth delivered services underneath plans. Perhaps you've heard of like, the licensure compact where it's not directly about telehealth, but it would make it easier for doctors to get a license in a compact state if they're in a state that's also in that compact. So there's been a lot of state policy going around related to telehealth. And there's been some administrative policy action at the federal level. The legislation itself on the federal level has not moved as rapidly as it has on the state level. However, while it's hard to get data for telehealth, there is a sense that telehealth utilization remains low. I don't have it here in this PowerPoint, but an example I'll give you is like 2015 numbers for Medicare. So Medicare is fairly restrictive in how you use telehealth, but they do reimburse for parts of it. But in fiscal year 2015, they only had about $18 million paid out of a potential $600 billion. So it's like very, very low, definitely underneath Medicare. And we've actually done a sort of study. I can't really talk too much about it because the funder of the study has not released a report yet, where we try to look at states who have passed telehealth laws to see if like any utilization has picked up. We couldn't get hard and fast data, but we did talk to health plans who are in those states where there were private payer laws that have been in place for at least a couple of years to ask them, and they have also said, utilization continues to be low. And we talked to a couple of Medicaid programs where they have like Medicaid policies on reimbursement, and they have said utilization continues to be low. So why is that? Why does telehealth utilization continue to not be at a point where you would think it would be, because a lot of new policies have been put in place. So there's kind of like, different factors people think. There's still reimbursement. Maybe the reimbursement's still limited in some way because you're only reimbursing like certain providers. There's the licensing issue. Yes, the compact may be great, but it's still like you still need to go through the process to get a license. It's not like one license, multiple states. It could also be expensive on the provider's end in that, they need to do the setup. They need to like buy the equipment. It's like really disruptive to their workflow because you're doing something new. Or there might be other policy barriers, maybe barriers around prescribing, which makes it difficult for them to do other things around telehealth. But one thing I think has been kind of ignored is that you could have all these great telehealth policies, and you have them in place and everything, in like, to kind of quote Field of Dreams, you can build it, but the question is, will they come? So I think that they're not going to be coming to watch a game at the stadium that you just built unless you actually have the players there who are playing that people actually need there. And those sort of two teams who are needed are really the patients and providers. So you can have all the great policies in place, but if you get resistance from the patients who are receiving the services and the providers who are providing them, it's not really going to work. So what do you need to do to get them engaged or get them willing to use telehealth? Well, you need to engage and educate. And engagement and education can be two different ways or two different approaches when you're talking about these two different groups, providers and patients. One of the things that you need to make them aware of is, what are the advantages of telehealth or telemedicine, whatever term you want to use. There are a lot of advantages too that they may not have considered. So that's part of the education and engagement process. So for providers, it's kind of two-step, and it's a different type of engagement and education, as I said, because most likely providers will know what telehealth is, like the concept of it, but you have to kind of convince them that it's a good idea for them to use it. Like with patients, providers are like, why should I do what I've been doing for years? Why should I suddenly, utilize technology when I've been perfectly fine seeing patients in person? Why go through all this hassle? So you need to inform them about what are some of the benefits from using telehealth, and it could vary because people have different ideas of what is considered a benefit for them. Maybe they can increase their practice and not only practice within the area they are in, but now they can cross state lines using telehealth and helping maybe an area that has a need for a particular specialty that you are, an area in another state that is lacking a dermatologist. There's also the benefit of being able to triage less serious cases. I'll use the dermatology example again. I remember talking to dermatologists. They're saying a very high percentage, I don't know if I'm exaggerating, but they say 95% of the time it takes me 10 seconds to figure it out because there are so many common skin conditions that I know immediately what that is. But that takes up so much time in my in-person practice because they come in, you take blood pressure, you take the readings and everything, the vitals for the patient, you talk with them and everything. Whereas over Storm Ford, where you take a picture of a skin condition and sending a dermatologist, it's oh, okay, I know what that is. It's hives or something. So that gives them more time for telehealth to sort out what are the more serious cases that then they can focus their attention on. Either they can do it via telehealth, or what happens probably in most cases is that they'll say this is a very serious case, I need to see this person in person. So that can also be another benefit. And then also being able to provide services to their patients in a more timely manner. It does in some ways take a lot more time when you do things in person than maybe in telehealth. It might be a little bit more effective and you can get services to your patient more quickly. Or if you're a primary care provider, there might be this long waiting list of trying to get an appointment to see a specialist for your patient, but you use telehealth and you might be able to connect with a specialist who is further away that your patient may not have wanted to drive to, but they can definitely see over live video. But what do providers need to see? So providers need to be convinced, though, that this is going to be good for them. You can tell them all about the benefits, but what's your evidence? And they'll always want to know, what's the research there? So you need to provide effective research that will convince them. But one other thing that you can do that I've noticed with some providers, when I've heard them be naysayers or I've read interviews with them, they're saying I didn't believe telehealth would work for this. It was not going to be something that I was interested in, but then you know what? My health system forced me to do it, and now I'm a believer. So seeing is believing. And it also, demystifies it for them by having that on-hands engagement and doing something and seeing how the technology actually works. So a couple of resources that I wanted to give you are the telehealth resource centers, because they do have some of the published studies and research. You might have to kind of depending on who you're targeting, and that's kind of been the problem with trying to find stuff around provider and patient engagement, is that what is in existence out there is probably pretty targeted. So it might be targeted to a specialty, or it might be a health system that has created something just for within their internal provider network. So it could be very targeted, and you might need to adjust it. But also setting up a demonstration. That can be very powerful for a lot of people, including providers. I also know demonstrations are incredibly powerful for policymakers to see as well, because then they actually see it working. You talk about it, and it's just kind of this concept that's out there. It is really the seeing is believing that helps folks out. The other thing with providers is that, once you've engaged them, once you convince them telehealth is great, you got to educate them, because you can't just suddenly just say oh, great, I sold you on telehealth, go forth and conquer. It would help, if you kind of help them with the steps and what they need to get started, and and what are some of the issues that they may encounter. So it could be operational issues on how to set up a telehealth program, from not only the administrative side, but something all the way down to the level of how do you set up a room. Because telehealth is a tool, just a tool to deliver services, but you do kind of have to think of things a little bit differently, because you're delivering services in a different way. So there's things that you can help them with to make the transition in using telehealth a little bit easier. Logistical issues such as how you set up in the room and how you present yourself on camera. Also, there's resources to telling them how they can get paid for this. It's great that they want to do this now for their patients and set it all up, but if you're not going to get paid for this, you're not going to be able to maintain it. What are some of the legal issues that they may run into? And then workflow. I think people sometimes get excited about telehealth and starting a telehealth program, but it hasn't hit them that this is actually pretty disruptive to your workflow and what you're used to. You're doing something else and you're doing something differently. It could disrupt what your usual workflow within your office. So that's something to keep in mind as well. Resources that you can use, so there are videos and fact sheets, webinar training sessions, and maybe a telehealth campaign. Some of the existing tools that are out there, again, the telehealth resource centers, a lot of professional organizations also have resources out there for folks. One of the examples is the American Academy of Dermatology. They have guidelines set up on how to do telehealth. I could not access that. I'm not a member of the Academy, and that's to members only. But I put that up there in case anybody is a dermatologist and maybe they want to access the link. But I also wanted to give that there as an example of some of the organizations having tools out there, but they may be very focused on a certain specialty or for a certain group. But those resources are out there, so it's really going to depend. What's kind of harder to find are sort of more general resources, telehealth overall. Those are a little bit more difficult to find. But there are a couple of things. Patients. So patients are a little bit different, because you have providers who are probably familiar or have some familiarity with telehealth. Patients may not be familiar at all with the concept of telehealth. They may be even more skeptical than your providers, because this is something, where the initial reaction would be how can I get services from a provider if they're not in the room with me? So there may be more convincing on the patient's end that needs to be done. For them, some of the evidence that needs to be stressed for them is that, yes, this can be as good or maybe even better than receiving services in person. I'm a telehealth proponent, but even I say, telehealth is not a cure-all, and it's appropriate for every situation. So it is a provider judgment on it being, whether it would be appropriate for the case that the patient is presenting with. But one thing that studies have shown when they've have actually sort of patient feedback in the studies is that one of the big things that patients said that they really loved was that it was time saved, the convenience, the access to the providers. That's like a thing that needs to be highlighted in engaging patients and educating them about the use of telehealth. One thing also that probably if you're a provider explain to a patient is, the different types of telehealth that they are available, the way they can receive telehealth. And those are the modalities of like live video, store and forward, and remote patient monitoring, explaining those differences to them, but also explaining to them like the situation of like where you receive telehealth maybe through your primary care provider's office versus a direct-to-consumer type of thing. So that would probably need to also be explained to the patient, saying like, it could be different from you coming to your doctor and them hooking you in via live video with a specialist, and you like being at home and you go on the internet and then you like pull up, something like a teledoc and you pay $45 for your credit card to help, take care of your kid's ear infection or something like that. I think that also should be something that the patient should know about, because, if you do the online system, there's that question of like, are those medical records being hooked up with like your regular medical records with your primary care provider, that type of thing. So that difference may need to be sort of teased out a bit more for patients as well. And with patients, seeing and believing is very powerful. So it might even be more crucial for patients because, again, they may not be very familiar with the concept, unlike a provider, and, they really need to see how it works. And then two other things that I think people kind of sometimes forget about with telehealth is that you need to be very mindful of their culture. There aren't a lot of studies, and trust me, we've looked at this, of like how different ethnic groups react to telehealth. A lot of the studies around telehealth have usually involved Caucasian test subjects. And they've been, a couple of them that we found that have involved a different ethnic group, they have flagged that there may be a bit of hesitation with the technology end for these ethnic groups. So you have to be mindful of culture as well. The other thing to be mindful for is that while you're educating the patient, you also really should educate the caregiver and family members as well, because they will have an influence on the care for the patient, especially if there's a caregiver involved. They're just as important to educate as the patient in the situation. So the big question with patients, and this is kind of where it's been a blind spot with like telehealth policy that's passed in recent years, is like, how do the patients even know about telehealth? I mean, you pass this private payer law, and okay, well maybe the providers know about it because if they're a network provider, the health plan probably informs them, but there's nothing in any of these laws to say like, oh, and by the way, health plan, remember to send out like a little flyer to your enrollees saying like telehealth is now being paid for and they can ask their primary care provider about it or something. So, really who it comes down to, like, whose job is it to inform the patient? Is it the state, payer, providers themselves, or could it even just be an outside group, like an advocacy group, like a AARP informing folks? It's never clear. It's because there's nothing out there that has directed anyone to do that. Just going back to, two things to keep in mind. And then if you are the ones informing, again, if you're the ones informing, remember caregivers and family members play an important role, and also to be mindful of cultural and linguistical differences. I think the slides kind of went back here, so let's see. So some of the tools that patients can use. Did I skip a slide? Hold on one moment. Okay. So some of the tools that can be used, again, like with providers or videos, fact sheets, a telehealth campaign, remember to make it multilingual. I'm from California. That's always a big thing here. There's like always a lot of different languages on things. But the thing is that Emily and I, before this webinar started, we were talking about like, how effective can all that be? Because I know I get a lot of like flyers and information from my health plan, and a lot of it I kind of just toss. So the question is, what is like an effective way of like trying to educate a patient? So I have links to 2 YouTube videos. I'm not going to play the AARP one. That one's kind of long. It's about 2 minutes, but it is like a very informative type of video where they, try to explain to people like what is telehealth and how can use it. Telehealth Resource Centers has a couple of things as well directed to patients. South Carolina Telehealth Alliance, they're actually a group that was formed from legislation in South Carolina. They have a couple like informational videos as well on their website that you might be interested in. But I wanted to highlight the United Care video. Some of you may have actually seen this, and hopefully this will work. Oh, maybe that's it. It's not letting me click on it. But it was a commercial that ran on national television, I would say maybe about 2 years ago, and it was about telehealth. It's like they're playing that Dirty Dancing song, Time of My Life or something, and they have this couple who are trying to do the Dirty Dancing move, and it goes horribly wrong, and they connect with their United Healthcare provider via like their iPad. So they don't say telehealth. They don't say that word at all. They just said like, this is like, you can do this underneath United Healthcare. So there are like ways to like, perhaps engage the patient where they might find that interesting. I don't know how effective that campaign was, but I remember watching it on TV a couple of years ago and thinking like, wow, they didn't say telehealth, but that is telehealth that they're trying to promote. This is another example of some of the promotion that's being done, and this is actually from CMS. So CMS has these chronic care management codes that they were started reimbursing for, I believe, in 2016, and they really want providers to utilize them. So they actually have put out there like toolkits explaining to providers step by step, this is what you need to do to enable to use these codes and get reimbursed for them. You'll see like patient resources, it says coming soon, but what they do have up there now is kind of like a little postcard that you can give to patients or can be sent out to patients. So this is like just another way of like how somebody is trying to engage providers and patients and educate them on this. Again, it's very narrow. It's for like these particular set of codes, but it's just interesting that CMS actually was one of the ones that had like a fairly full set of resources for this. But probably who is going to be kind of like your best advocates for this and get people interested in this is the patients and providers themselves talking to each other. So I've just said like a few minutes ago, I get a lot of information from my health plan, and a lot of times I just throw it away after just glancing at it. But if I'm in my office and I'm talking to my primary care provider, I'm probably going to listen to what they say. And if I'm a primary care provider and my patient is suddenly saying, what's this telehealth, and how can I get it because I don't want to like go and see this dermatologist you're recommending, can I just do it from work or something? They're probably going to be the ones who are going to be educating each other and also demanding the services from each other. So it's kind of like they're probably the best advocates, proponents for this, and the ones who are going to start this train about educating and engaging as well. And that's about it. I think I saw a question from Jennifer here. Natalie, if you're okay, I'll go to that first on the questions.
Sure.
Yeah. How do you address provider concerns about malpractice when providing services via telehealth rather than in person? Is there any additional cost to insurance if they're providing telehealth services? We get a lot of questions about this. So the thing is, we always tell people there's 2 ways of looking at malpractice. So first off, there is malpractice about suing. There's actually not been a lot of cases regarding telehealth and malpractice. I think that's the law of numbers, though, because telehealth isn't as widespread. There's been less opportunities for people to have a malpractice case. I think once telehealth becomes more widespread and utilized, probably we'll see those numbers come up. But there's not a lot of cases out there right now. A lot of them involve radiology, and it's usually not about the technology. It's more about the radiologist maybe reading something wrong. But the other way to look at malpractice, and that Jennifer pointed out here in her questions, is that you need to think about your malpractice insurance. And this is there's nothing out there that are hard and fast numbers. This is a lot of anecdotal stuff that I've gotten, is that carriers, first off, if you are going to start telehealth, utilizing telehealth, check with your carrier. Make sure that your current plan covers it. If it doesn't cover it, see if like the carrier itself will cover it. And also, if you are thinking of going across state lines, if that carrier's insurance will protect you across state lines, because not all carriers operate in every state. So you need to, those are the questions you need to ask them. Anecdotally, what we've heard, it's been very split. We've heard people who said, like, absolutely no problem. My current insurance is, like, covering me, and my carrier confirmed that. I've heard other folks saying, like, it's a problem. And one of the problems is that a lot of carriers, because telehealth has not been widely utilized, they're not quite sure how to price the premium, so they tend to price them high. And that has actually kind of priced out some providers in telehealth because they can't afford the malpractice premium, so they're just not going to bother with telehealth. This has not been a high policy issue out there around telehealth. The only state that has actually touched upon it is Hawaii. It was a piece of legislation they passed last year where they have kind of said, you know, you can't price somebody out. You need to kind of like offer this to them. But that has been the only piece of policy out there. It's been kind of a hidden issue, I think, for telehealth providers as far as like the policy and people addressing it. I do know with the association that represents these carriers, we've talked to them a couple of times, and you know they're not quite convinced it's an issue, but I'm still running into providers who are saying it is.
Great. Thank you very much, May, and just thank you for your presentation. And as everyone knows, we are moving into the Q&A portion of the webinar. So I just want to remind you that if you do have questions, feel free to open your line and unmute your line and ask your question through the phone, or you may still type your question through the chat box at the bottom of your screen. At this time, I'm going to pause to see if there are additional questions from anyone on the line.
It doesn't have to be on this. If you have a telehealth question, I'll try to answer it as well, too.
Great. That's helpful, May. You know, while we're waiting, I want to go back to something that you had talked about, just about the different types of patients, different groups of patients in the populations that providers are working with. Can you kind of talk a little bit about some of the outreach strategies for certain groups that might be helpful?
You mean different patient groups type of thing?
Yeah.
You know, the one that I've seen that's been really kind of active on this has been AARP. I know you have like the YouTube link. They've actually, and AARP, they're one of the ones who have focused in on not only the patient, but also like the family caregivers and the families as well. So they have not only the video that I did a YouTube link on, but they also have like caregiver engagement videos that I know they worked on with University of California, Davis. So that has been kind of one of the groups that's actually made it a concerted effort to do outreach to like their membership on telehealth. Other groups have been a little bit slower, I think. Some of the disease groups, I've been talking a lot with some of the autism groups, and they've been a little bit slower in like doing this, but there definitely is an increased interest in telehealth, and that's kind of like also been the problem. It's like you find yourself with telehealth is that this is really kind of a niche field. I mean, when I meet like people and just chit chat with them, they're like, oh, what do you do? And it's like, oh, well, I work in telehealth policy, and they kind of give me this blank stare. So I think a lot of like kind of like these advocacy groups who might perhaps focus in on a specific health condition, you know, are just starting to like kind of work their way in and like, you know, realize about telehealth. So they're trying to find like their footing and how best to engage their constituencies. AARP is probably one of the more advanced groups that have done something so far.
Thank you.
Well, also, if you guys think of a question later, there's my email address. Feel free to email me as well, or like, you know, I guess Natalie and Emily, if somebody sends you a question, feel free to forward it to me too.
Thank you, May. Look, I do have actually one additional question.
Okay.
Many others. I think at the beginning of your presentation, you talked about the challenge for providers with the licensing part of it.
Mm-hmm.
And, I know that there are this interstate compacts, and some of the states are participating in that. Can you talk a little bit about that at all, and if that's something that, would be a viable option for states as they're looking at their providers and how they're able to provide telehealth across state lines?
The compact itself?
Yes, or just that model, and is that something that, just even a little bit about the model a little bit. Is that something that would be of interest or something that would be helpful to states as they are looking at how to increase their provider engagement and making sure that they are licensed to do that?
It could be, but one thing about the compact that I want to stress is that it's an expedited process to get a license in another state. So it's not one license, it's effective in multiple states. It's not like the nurses compact. The nurses compact is you get one license in a state that's a compact state. You can practice in all those other states with that license. You do not have to get like another license. So that's kind of the difference between the two compacts. And they're still trying to get the doctor compact, physician compact up and running. There's, I think, about 13 or 14 states right now who are members of that compact. A couple of them have run into a little bit of an issue with some of the wording that they did the legislation, so they had to go back and kind of adjust that. So that's kind of, I think, slowed down the process on it. As far as I know, I don't think it's up and running yet. So I don't know, what impact that's had because it hasn't had time to show an impact. There are also other specialty groups who are looking at the compact concept. I think all of them are looking at it the way the physicians do, which is an expedited process rather than one license, multiple states. There's a psychologist compact. I think it's psychologists and not psychiatrists, but there's a psychologist compact, and I think the physical therapists are looking at something similar too as well. Whether, it's like the devil's in the details. If it's really like an expedited process, I saw the outline of what FSMB had laid out, and I had a couple of questions on it. Especially with is this really going to be faster? And also it kind of sounded like it could be more expensive too for somebody to do this. But that was at the starting point. So, if things can be different when they've actually put it in place, they'll be more detailed on how they're actually going to administer it. So it's, in my opinion, the jury's out until they've actually got it up and running and they've done it to see how much of an impact they'll have.
Great. Thank you, May. And we do have about 20 minutes left, and right now we don't have additional questions that have been flagged to the chat box. I want to also just see if this is a good time maybe for us to talk. There's not many people on the line, so I do want to just kind of hear from some of the participants perhaps about just their take on the information May has just provided to you and presented. Does this, spark any ideas, in your state? Does it, spark any thoughts on challenges or anything or if you would like to kind of provide a little update on what you're thinking on next steps and how this may advance and fit into the work that you're doing, this would be a great time to talk about that since we have some time left before we end. And don't forget to open your phone lines as well and to unmute your lines so that you can.
Hi, Natalie. This is Jennifer. I typed in a question, but I guess it didn't come through. I have a question for May. If she has any recommendations or samples on how to survey patients and possibly providers on their experience on, after they had a telehealth visit or, even on their feelings before offering the service.
I can get you some, Jennifer. CCHP doesn't have any personally, but I could probably just telehealth resource centers. I'm sure some of them do. One thing with the telehealth resource centers, another reason why they're kind of a good source to tap, is that about half of them are associated with major universities as well. So there's kind of like additional resources that they tap as well. But I will, ask them and get a couple over to you.
Thank you.
And May, I apologize. There are several questions under the chat feature here.
Okay. I see. All right. I'm seeing 5 now. All right. Let's go.
Yeah, that's come through. There's some under the chat feature and also this question. So one question from Carolina Moore. How do we know how to inform our providers on how to get reimbursed? Since it varies greatly from plan to plan, and that has been a source of frustration for them. Can you shed some light?
Yeah, that has been like a big problem. It's kind of one of the So with some of these telehealth private payer laws, there's been, if you really examine them, there's been a lot of flexibility given to health plans on how they do their reimbursement. So it can vary from health plan to health plan. And I will tell you right now, they guard those jealously, those policies. I have tried, and some of them have been very open and been willing to send me like information on like what they were reimbursed for. Others I've gotten stonewalled. So it is difficult. It's difficult, and I can understand the frustration. I'm a little confused though in that, if they are a provider within the health plan network, why they can't get the information themselves from like the plan. So my question would be, would these also be providers who are maybe outside of the network who are seeing patients and then trying to get reimbursed that way? Is that part of the issue as well? Which would explain why they can't get like the information. One of the things, I think this goes back to like the purpose of this webinar, is that I don't think the health plans are also hearing from the patients. I mean, if like a patient wants to do this, and the enrollees need to probably demand like this information be made available. And I think policymakers are getting wise to this. So there's been a bill in Texas that just recently passed. It had a whole bunch of stuff in it, but one thing that was interesting in there, it would require health plans to put that information, their telehealth policies, on their website and make it available. But it has been kind of like this, vault of information, which we haven't been able to crack and get it. I mean, some health plans are pretty open, and they're like, here's the policy. Others are like, what do you want it for? No way are we giving it to you, because it's a competition thing. So, I feel your pain there, and I understand why this has been a source of frustration for everyone. Where can I get more information on telehealth campaign? That was just a concept. So there might be a telehealth campaign. It would depend on who's doing it and who they're targeting. So that was just really, when I put that on the slide, that was just something that you can consider doing it. Trying to think of a specific example of somebody doing a telehealth campaign, and quite honestly, I can't think of any right now. But I would say, if you were interested in starting a telehealth campaign, first off, figure out who your audience is. And I don't know if whoever's starting it, if they are an AARP or an MS society, if they're a specific constituency that they're targeting. So who the audience is, and then how to make the information relatable and easily understandable for folks. I'm in the policy area, so sometimes I can write very complicated things. I'm thinking a lot of patients won't want to read what I write because it's very dense sometimes. It gets in the weeds. It's heavily footnoted. So you got to figure out when you do the campaign, what's going to attract their attention and not only inform them but make them want to read what you're trying to put out. Jennifer has a couple questions. Our health department wants to get involved in offering client services via telehealth. Is there any information on local health departments becoming approved originating sites under Medicare? I don't think they can be. Medicare has a very limited list of what are eligible originating sites, and I don't believe local health department, unless they're regarded as something else, and they're not local health departments. Local health departments aren't one of the eligible sites underneath Medicare. Now, Medicaid policy is different. Medicaid, the state Medicaid programs can decide whatever they want is like an eligible originating site, but underneath Medicare, that's not one of the eligible sites that I remember. It's usually like skilled nursing facility, doctor's office, a hospital, FQHC, RHC, something like that. A local health department's not listed underneath there unless I'm, ignorant of this, and it can be considered a doctor's office or something. So it probably would not for the Medicare program. Do you have any recommendations or samples for how to survey patients? Oh, okay. So I'll get that to you. Survey providers on the telehealth use experience. Okay, and I said I would get the samples. Try to find some samples and pull them together and send them over to, you know what, I'll send them to Natalie and Emily so they can distribute them to anybody else who's on this call who may want to use them or see them. Any more questions? I think I got all of those.
Can I add a comment?
Uh-huh.
This is Carolina. I'm the one that asked the question about how do we get the laws based on payers, and do we just need to call each one individually? And the way we've approached it is we're trying to be proactive and just, we're getting questions from our doctors. We want them to start using telemedicine, but then they ask us, well, how much am I going to get paid? What's the reimbursement? And I don't know those answers, and I am running into those roadblocks where the payers say, no, it's not covered, no, we follow the CMS guidelines, and so that's just, there's no question here. It's just more of a frustration.
Yeah, I feel your frustration, and that's kind of, the study that I mentioned that I really can't talk too much about because it hasn't been released by the funder, that's like a major source of frustration, is that there is this kind of like protectiveness of the information, but there's also kind of like this flexibility in laws that are passed where, they can't do different things within health plans because they, technically, legally, they're allowed to do that because of the way the law is written. And you kind of think like, oh, they're all doing it the same way because the law says that you have to cover their services. Well, you dig a little bit deeper into things, and then it's like there's some outs that may have been intentional or unintentional because, when I was talking to somebody, as they pointed out, they weren't a payer. They're more on the government side, and they said, not knowing what's going on in these states, it's like that may have been an intention of policymakers, is that they wanted to provide that flexibility for them. But it creates kind of like this difficult environment to get a straight, consistent answer because everybody's kind of doing different things, and then you get people who kind of stonewall you. One of the things that we did with this study is we picked a sampling of states that had telehealth private payer laws in place for a couple of years, and we tried to contact plans in those states just so they would interview them, so we can interview them, and we got a lot of no's. This was for 3 months. We were just calling health plans, reaching out to them. We got a lot of no's. We got a couple who said yes, but then I had to de-identify everything in order for them to speak freely to me about certain issues. So, yeah, it's a tough road, and as the policy center, we get that all the time of oh, why can't you, our 50 state is the laws and everything, and it also has the Medicaid policies. Well, the Medicaid policies, the Medicaid programs put those out publicly, so it's always easy to look at that. But we always get questions, why don't you have something with private payers? It's oh, that's really difficult to nail down.
Are there any additional questions for May before we conclude? Well, please let us know if you have ideas or suggestions for other resources that we can assist to help advance telehealth in your state. And at this time, we will end the Q&A portion of the webinar. Again, if you have any follow-up questions, please use the contact information on the screen, and we will ensure that our speakers receive your questions. And we will also disseminate the information that May sends to us to participants on the line today once we receive it. And as mentioned earlier, you will be immediately directed to an evaluation at the conclusion of our webinar today. Please take a few minutes to complete our survey, as it provides us with very useful information that informs the rest of our work and future projects. I'd like to take this time to thank our speaker, May Kwong, for her presentation. I'd also like to take time to thank Ms. Jennifer Kellback for her leadership, and each of the state leads who may have participated in this call for helping to coordinate. So thank you very much, everyone, and please enjoy the rest of your day.
Thank you.